Hey guys, it's Dr. Dusty. Today I wanted to talk to you about the anxiety our pets can feel when they come to the vet. And we know it's a place they can associate with getting their shots or getting temperatures taken, so sometimes some pets are a little more anxious about that, and there's things we can do to help make it easier for them. For dogs, there's really two common considerations for helping stress. First is medication, and that's directed specifically at the anxiety that they're feeling. There's several medications you can administer at home before coming in that can help with anything from car renting anxiety to the stress of actually coming into the hospital. Most commonly we use trazodone or acepromazine, but there are several other options depending on what your pet responds to best. All pets respond a little bit differently, and we've got to try them before we know for sure how they will react. We also have non-pharmaceuticals if you prefer, like Zylkene and Adaptil. We like to try these at home for a dose before coming in for the vet visit. Make sure it is working well for them and it's the right level of sedation to ease their anxiety and also allow us to do what we need to do to keep them healthy. In the event you do that trial dose and it doesn't work well, or you come in and it's not the experience we were going for, we'll try a different medication before the next visit or to try out at home before you come in. Once we do find the medication that works well, we'll use it 30 to 60 minutes before coming into the hospital for visits. And just so you know, these are the same meds we would use for thunderstorms, fireworks, those sort of things that can scare our pets as well, and they can be really helpful for getting through those loud events. The second consideration to help with stress is the actual experience at the hospital. This starts with waiting to get into the exam room. Depending on how busy the hospital is, your wait may be longer, and some dogs do better if they're in the car instead of in the lobby. If you find that's what you would prefer, your pet would prefer, let us know. We're happy to accommodate that. Once they're in the exam room, we'll work with you and your pet to find what works best. That's something we want to communicate with you and see what you're most comfortable with, kind of talk to you about what kind of body language they're showing us, so that we can pick the right handling of your pet so that the stress is minimized. We're very well trained at observing body language, so we're going to let you know if they're feeling protective, painful, if they look like they might try to bite, and we'll talk to you about what we think is the best option, but just communicate with us with what you're comfortable with, what you're not comfortable with, and we'll work to find the best route. Some dogs, it's being on the table is best. Some dog on the floor is best. Some dogs, it's feeding a lot of treats that will work well. And some dogs, it may be that we need to put a muzzle on for them to allow us to look at them. So talk with us. We'll be happy to go through that, and we'll make notes in your pet's chart to make sure it's consistent moving forward with what works best. I do recommend if you have a particular treat you know your pet really likes, bring a bag of that when you do come to the vet, and we'll give those as we do the exam. But also, even when you pull up in the parking lot, when you're sitting in the lobby, positively reinforce every aspect of the vet visit will really help with future visits. For cats, we like to use either gabapentin or buprenorphine as our medications to help with stress. They're administered very similarly to what we've talked about with dogs. When you get to the hospital, we'll provide you with a towel sprayed in Feel Away, which is a calming pheromone for felines, and we place that over the carrier while you're waiting. We do provide a specific cat waiting area to limit exposure to dogs that may stress our cats, or if it's easier for you, waiting in the car is an option as well. We do try to use specific rooms only for cats to limit how many smells are in there and try to make our cats more comfortable in there. And when you get in, we'll use probably a towel to give some comfort. We'll use catnip, we'll use treats, various things to try and make it a little bit more anxiety free. And as we talked about with dogs, we'll watch your cat's body language to assess what's the best way to handle your pet. Even the sweetest cat at the hospital sometimes acts differently than what you're used to, so we'll communicate with you about what we're seeing, what you're seeing, and try to decide the best way to proceed forward. If you have any questions about your own pet's anxiety or their visits, past visits, what you're anticipating for the future visit, give us a call. We're happy to talk through with you what's the best route to go for your pet.